So I've been practicing both cosmetic and nutritional medicine for about 15 years, and I introduced both fields of medicine right from the very start because I wanted to manage the external signs and symptoms of the various aesthetic presentations that I was seeing, while also address the internal or the underlying factors that lead to these signs and symptoms. And I think that's allowed me to take a more conservative approach with cosmetic treatments, which is where aesthetics is really heading anyway. We're moving away from the overfilled faces, and there's a growing interest in new devices and nutrient therapies for skin health. But when it comes to nutrient therapies, they really need to be personalised because that's what optimises results, and that can be very difficult to implement in a busy practice. So I've created a program that uses an algorithm to develop personalised nutritional plans online, and I'm now making that available to health practitioners and clinics across Australia. My main areas of interest are longevity medicine and personalised nutrition because they're really defining the root causes of ageing and chronic conditions and looking at how we can individualise diet and use nutrients as therapeutics. What the research is showing is that while ageing is still inevitable, the rate at which we age can be modified, and we're not destined to develop chronic conditions even if they're considered genetic, because genes can actually be switched on or switched off using various nutritional strategies. So these findings are really exciting, and while research still has a long way to go, there are certain nutritional strategies that are filtering through into every field of medicine, including the aesthetic industry. Symptoms like rosacea and hair loss and weight gain are actually downstream effects of pathological processes like leaky gut and inflammation. And it's now known that gut-derived inflammation and the inflammatory cells and molecules that are produced form these signalling pathways between the gut and other organs like the brain, the skin, and even fatty tissue. And that explains why stress is often associated with symptoms of irritable bowel or even with weight gain, and all three of those have been linked to various skin disorders like acne and psoriasis. It's all interconnected. There is a very complex interplay between nutrients and our genes and our physiology. So research is looking at how nutritional strategies can be used to manage these underlying pathological processes and improve the messages that are being transmitted through these signalling pathways. And there's no one size fits all, so personalised and precision nutrition are really essential because everyone is different in how they respond to various food components and nutrients and even different dietary interventions. So these are the things I look at when I'm creating personalised plans, and I always read the new research and update my protocols as new findings come to light. What I've found over the years is that while people are certainly becoming more health conscious, they're also more overscheduled than ever before, so they find it difficult to commit to regular consultations and reviews, and they're looking online for advice. Now the problem with that is that much of the nutritional advice, even if it appears to come from a credible source, is often based on research findings that have been misrepresented or misinterpreted. So people are following this very generic advice that's keeping them stuck in a pattern of recurring symptoms, and they're just getting frustrated and very, very confused. I wanted to make well-designed, personalised nutritional plans accessible to all patients in any setting without the need for consultations. So I've compiled my protocols into an online, streamlined new delivery system called Bio-Alai. So Bio-Alai uses an algorithm that factors in individual parameters like age, genetic predisposition, medical conditions and symptoms, and dietary preferences, and it uses this information to create a personalised nutritional plan that works with the patient's unique physiology and helps them achieve their goals in a way that's safe and sustainable in the long term. Everyone is different in their nutritional needs, and some people may need some extra support. So I've developed a nutrient formulation that provides that additional support at a cellular level. It's a TGA listed complementary medicine, and it can be used alongside the personalised plans or on its own. With Bio-Alai, I really wanted to encourage autonomy and a long-term self-directed approach to health. So the program comes with educational videos and very detailed guidance on how to incorporate different dietary techniques for specific therapeutic goals, or as long-term support to potentially help extend health span, which is really what longevity medicine is all about. For me, it's just so rewarding to see my patients achieve their goals, because I know it can be life-changing. I know that while they're thrilled that they look better and they fit into their skinny jeans, I know they've achieved so much more than that. They've improved their gut microbiome, they've reduced inflammation in the body, they've supported their mitochondrial function, and these are really essential to reset your metabolism and also to balance certain hormones. And some people may have even switched off genes that would predispose them to developing certain chronic conditions. And these benefits are only really possible when every process that's responsible for health is systematically supported and very gently guided towards optimal function. So it's not just about looking better, but this can actually change the course of your health. I think every patient in any setting can benefit from a well-designed personalised nutritional plan, and so I'm really excited that my company Bio-Alai is now partnering with nurses and doctors and allied health professionals to bring these personalised solutions and offer them as an adjunct to their service without the need for consultations or tests. So Bio-Alai is due to be launched in January next year, and in the lead up we have an extensive implementation and marketing plan that includes education and training for all clinic staff to help them prepare for the launch and to confidently introduce Bio-Alai as a new aesthetic service. And this training and this implementation plan helps to establish the clinic as an accredited Bio-Alai provider.